Eliminating avoidable blindness. Is it really possible? I mean, not just in the city where we live and where we work, but right across the globe? And if it is possible, who should be doing it and how? Let's discuss. Welcome to Bolivia. My name is Dave. I'm the General Manager of the Andean Medical Mission, and I've wanted for a long time now to put together a little series about what we do in Bolivia and kind of set up a discussion forum for ophthalmology. The idea being that the Andean Medical Mission has been working in Bolivia for 10 years now, and we've got a lot of experience. We've learned and developed and got better as we've gone along. My idea really was to try and share what we've learned with other people who are interested in working abroad, working in countries with developing eye care services like Bolivia, but it could be anywhere in the world. I think what we've learned is applicable right across the globe, wherever you're planning to work, and also to kind of encourage people to get more involved in developing eye care services abroad. There's a whole ton of work that can be done still, and I decided after some thought and a little bit of market research to call this series Beyond 2020, and there's some reasons for that. So firstly, 2020 was going to be this magical year where blindness or avoidable blindness was eliminated right across the planet. I remember in 2012, 2013 doing talks and telling people, you know, we've got 7 years, 8 years, whatever it was, to get this right, to try and get rid of avoidable blindness on the planet. And I knew it was a short time frame at the time, and to cut a long story short, we've not achieved it here. It hasn't been achieved really at all. There's some big steps that have gone forward. Things like Colombia eliminated river blindness for the first time, first country in the world to do that. Wonderful work that they did in Colombia. But river blindness wasn't a massive thing in Colombia. They don't have that many rivers that were suitable for the larva, and you know, but great, they did it, and that's fantastic. But cataract blindness still accounts for a huge amount of blindness across the world. Pterygium's a blinding disease. Services have developed over these last 8 years, but in the wrong places largely. Lots of models that were tried, sort of the if you like, the Lions type of cataract camps are wonderful in helping individual people. And certainly people have benefited. We've done lots of trips like that where we've gone along, we've operated on a whole lot of people who are in their late 80s and 90s, and it's lovely, they get to see their families again. But it's not eliminated blindness. Probably there's the same number of blindness, or the same number of people blind in Bolivia today as there was in 2012 when we first started operating here. We clear quite a bit of it, Bolivian services clear quite a bit of it, and then every year more and more people become blind. So the concept of this series is, you know, what is beyond 2020? We're now 3 years down the road. Have we adapted our strategies? Are we better? Are we chasing excellence? And I think we are, but we've got a long way to go. So the series that I'm going to put together, I'm going to try and publish something every 2 weeks, if that's possible, maybe more if I can. Obviously, developing eye care services need ophthalmologists to come to talk about ophthalmology, to help to design services. But that could be surgeons, that could be non-surgical ophthalmologists, it could be doctors with a good knowledge of eyes, it could be nurses, optometrists, orthoptics. There's almost no orthoptics in Bolivia at all of that. Even refraction is something to be involved in. It's a big area. It's probably not right now the most important thing, but it's important for sure. So anybody who works in those fields, but also people that are just generally interested in setting things up, are good organizers, good administrators, people who are good with finance, people who are good at raising funds. There's a whole ton of jobs, if you like, mostly unpaid volunteer jobs, but they're incredibly fulfilling. And so it's to look at, I'm trying to identify people that will be interested in doing this, interested in following what we've done at the Andean Medical Mission, maybe coming and working for us, or maybe joining another charity that, or another organization that you think fits with what you want to do, what values you can bring, what skills you can bring to the table. So it's to encourage you, and I'd like this ultimately to be a forum for discussion. We can certainly learn from other people that have done this before, or even people that haven't, that have good ideas. I'd love to hear those ideas. So from my point of view, it would be great if you would like this video, if you would subscribe to the series. Beyond 2020 will be published on YouTube, will be published in iNews, which I think is spectacular, and I'm so grateful to iNews for this platform to be able to talk about what I think is a really important subject. And so yeah, come along, follow us, join the conversation, and let's see if together we can make a difference. So the subjects that I'm probably going to focus most on, there's going to be a lot about surgery. So surgery isn't everything in ophthalmology, but it's an important part of eliminating avoidable blindness, because a ton of blindness is cataract. So we look at patient selection, we're going to look at how to set up operating rooms, what equipment potentially you're going to need to buy, what can you bring with you in your suitcase, and the size of teams that you're going to need, how to keep teams safe. All of that kind of teamwork side of things we're going to tackle. We're going to look at different surgical protocols. A lot that we've developed over this 10 years has been a result of having difficulties with an operation and working out how we could have avoided that difficulty in the first place. And Andean Medical Mission has been so fortunate with the surgeons that we have had as volunteers. Many have had thousands and thousands of operations under their belt and have brought new things to the table every year, and I'm constantly updating, refining our surgical protocols so that we have the best practice that we can possibly have to get the best outcomes. So I'm going to talk about that. I'm going to talk about measuring outcomes. I'm going to talk about publishing your results and how important that actually is in making sure that you're not going on a trip just to do some numbers, to take some photographs and go home, but actually you look at how good you are, or if you need to make improvements, what you can do to improve, because this is a really serious topic. You're going into someone else's country and you're trying to help individuals to see better, and you can't go in and practice, you can't go in and have a go. You must go into that country knowing that you are the best option for those patients and only do good surgery. So we're going to talk about that. We're going to talk about setting up operating theatres where there are none, how to deal with infections, how to deal with communications to patients, publishing or publicizing what you're doing. We're going to look at the legal side, so getting permissions, not ending up in jail. You wouldn't want to be in a Bolivian jail, I assure you. If you end up one, I will visit you, but you don't want to be in a Bolivian jail, or any jail. So if you're doing this job, you've got to work legally. You've got to also work in conjunction with the services that exist in that country. You can't be undermining what somebody else is trying to do. So we need to coordinate, and we need to do that generally through the Ministry of Health or through the governing bodies in that country. You can't work alone. So we'll look at all those things, and I think it's going to be a fun journey of learning and sharing over the next few weeks. So as I said before, please join us, like and subscribe, get involved, make comments, good or bad. I'm happy to take your views, whatever they are, and share with your friends and colleagues as well who are interested in this topic. So thank you for listening to episode 1. It's very brief today, I know. It's just an introduction to the concept and to the topics that we're going to be talking about in this series. So I hope you enjoyed this, and I'll see you in the next one.